Hello everyone. Today my colleague Julie Solmara Contreras, Sergio Esteban Aguirre, and I, Juan Esteban Torres, are going to give you a little talk about mental health, a highly popular problem discussed in many areas. Mental health has been discussed for many years, but is a current thing where it has had a great boom and popularity, where various institutions and organizations at global and national levels have current of dissemination campaigns. What do we understand by mental health? According to the World Health Organization, mental health is the well-being that persons experience as a result of their proper functioning in cognitive and affective aspects, and ultimately the optimal deployment of their individual potentials for coexistence, work, and recreation. It's one of the basic needs of the human being, which is why governments, communities, families, and individuals must always worry about maintaining optimal levels. Mental health is determined by social, environmental, biological, and psychological factors and includes conditions such as depression. But in this introduction, it should also be mentioned that mental health has become a regimen of identity and has turned people into a diagnostic. It's a very complex topic, and many students are need to describe it. We will try to give on explanations to the issues of mental health, taking into account that these should always be treated by health professionals and other areas. My colleagues will explain the figure's current conceptions and their conclusions. Thanks.
WHO calls for attention from all countries to strengthen mental health and psychosocial support service. In the first year of the COVID-19 pandemic, the global prevalence of anxiety and depression increased by 25%. Currently, almost all the countries in Latin America and the Caribbean receive some type of mental health corporation from WHO. Since the beginning of the pandemic and in response to the effects of COVID-19 of mental health of different population groups. The agency has working to develop and disseminate resources in different language and formats. Mental illnesses increase more among women than among men, and among young people than among adults, according to the new report by the Health Agency, which says this situation as a wake-up call and urges all countries to improve her support for this type of condition. One of the main causes of this increase was the unprecedented strange caused by the social isolation brought on by the pandemic. This was compounded by the other factors such as people limitation in working, research, support from loved ones, and participating in their communities. Other factors that led to high levels of anxiety and depression were loneliness, fear of infection, fear of suffering, and death, both for themselves and their loved ones, and financially worries.
That is why today more than ever it is important to talk about mental health, taking into account the peculiarities and the data offered by these statistics. We can think of solutions aimed at the specific problems, respond to the needs of a society that is becoming more and more aware of the importance of personal care or self-care. It is true that each individual as an essential part of society has in their hands the capacity and responsibility to inform themselves and work to build a better future in terms of mental health. But it is the governments in whom the strength and capacities are concentrated to create the significant change. The implementation of mental health programs in schools, including topics related to managing emotions, emotional intelligence, and life skills in academic projects, can positively impact the population of young people, children, and teenagers who are currently the future of nations. How? Simple. Talking about it in schools can help them to cope with the stresses of life, be physically healthy, build healthy relationships, contribute to their community, work productively, and reach their own potential. In order to generate this great change, we must first join one by one from our individuality, inform ourselves in reliable sources about mental health, and promote mental health prevention strategies that currently exist. Eliminate the taboo that has been imposed on us over time, the fear of talking about emotions, suicide, mental illness, and think about the options we currently have to address these problems. Ignore this is not one of them. However, little by little, progress has been made in the awareness of mental health, as people are understanding its importance. In addition, the need for a health system reform that strengthens mental health care processes becomes more evident over time. This exponential growth is constant and does not decrease, so we can expect good things from the future. Thanks for watching.